Wrapping up, and Meera Shiva has announcements, if any, about lunch and when we come back. अच्छा वन अभी हम निकलेंगे 1:30 बजे. We have to come back. See, the afternoon session is absolutely loaded, and people are leaving their work. Like Dr. Jacob, some relative has had a surgery, but he's coming because vaccine issue is so critical, medicine issue is so critical, and you do maternal death free, all that. So the speakers in this had a privilege of more time. We had thought that we'd have more discussion. We kept half an hour for discussion. So we thank them, and we thank you. 1:30 we have to come back. Please don't mind. और उसके बाद खाना उठा देंगे बोला. Thanks.
और अगर कोई बाहर जा रहे हैं, you're leaving your room and going out, please leave the keys at the reception. रिसेप्शन पे चाबी छोड़िए, वरना कोई दूसरे रह रहे हैं आपके रूम में, उनको तकलीफ हो जाती है और फिर रूम साफ भी नहीं हो पाता है. सुबह आज
is going to be chaired by Dr. Shifter Mathur. Has, besides being in a medical college and teaching, inspiring young students, he's been very much involved in the health movement and for many years. So what I'm going to do is I'm going to hand over to him to introduce and also call on the speakers. Again, the time limit given to us is 3:30. I do not know, this is the morning में बाहर चाय रखा था कि जो निकल के अगर पीना चाहें, मेरे ख्याल से शाम को भी चाय बाहर होगा. The session will not break. तो जिसको होगा अपना चुपचाप, मगर ये इसको whoever gets up, please do not do that खटखट noise. So this little disturbing. हाँ तो थोड़ा सा. So Dr. Shiv Charan Mathur, who's from the government system and the healthcare system, and also very much involved. I should have mentioned from basically from Rajasthan. He'll be chairing and मैं कुछ भूल गई बारे में क्या लेके
Good afternoon, friends. Meera has directed us that now we have only 100 minutes left. So we already won. And my observation in the morning was that somehow some sort of injustice was being done to the speakers. So I am asking my colleagues making various presentations, and to you also, that we should have a fruitful discussion after each presentation. Presenters themselves will also take care of time, and you also, while asking questions, be specific so that we can do justice to the time and we may be able to use all these 100 minutes effectively. The theme, as you have read in the program, this session is going to be on drugs. And there are 4 speakers. First of all, I am introducing Dr. Shakti Velu from Public Health Foundation of India, whose president, chairman, Mr. Reddy, spoke in the morning. And Shakti Velu is basically a health economist who earlier worked in the National Macroeconomics and Health Commission. And his work is focused on the drugs, and he is going to talk to us on the issue of universal access to medicine.
Friends and colleagues. So what I intend to do in the next, do I have 20 minutes? 20-25 minutes? Yeah. So what I intend to do in the next 20-25 minutes is to essentially identify some of the major barriers to access to medicine. And then, anyways. Well, what I intend to do in the next 20-25 minutes is to essentially identify some of the major barriers to access to medicine, and then provide you with what the major recommendations that we have come up with, the high-level expert group on universal health coverage has come up with. Now, as you all know, most developed countries have achieved universal health coverage for most 40-50 years before. While several developing, in fact, many low and middle income countries in the past 10 years have embarked on the path of universal access to healthcare the last 10 years or so, which includes Mexico, Brazil, Thailand, Ghana. Ghana is very important for the simple reason that Ghana is in fact one of the lowest low-income country, lower than our Indian economy. Having said that, the interesting thing about Ghana is, Ghana, of course, the sub-Saharan African country, they have a system of universal access to medicines. So it's a free medicine, cashless free medicines to everyone in Ghana. A country which doesn't have production capacity, which imports most of the drugs from India, has this scheme of free medicines to all in Ghana. So the question then is, India, which now boasts itself of being the pharmacy of the developing, of the global south, supplies not only essential generic medicines but good quality and affordable drugs to not only low-income countries, even to most high-income countries, including US and European countries. So the question then with us is, do we have enough resources? Do we have the capacity to achieve universal access to medicine? Now, these are the questions that I'm going to raise here and then try addressing some of these. Now, the question, as far as India is concerned, there are 5 or 6 major issues, which I call it as major impediments to access to medicine. And I think one of the foremost important issue, which I guess morning speakers have spoken about, is the issue of unfair healthcare financing mechanism. And what does it mean? It basically means that if you have 3 principles, prepayment, cross-subsidization, and risk pooling, then it is called a fair health financing mechanism. But if you don't have, we have a situation in which households end up paying a lot of money, major share of their income on healthcare, especially on drugs. This is what is happening in our country. So we have a system where the financing mechanism is unfair. 2, the other major problem with our country is we have an unreliable and inefficient procurement and distribution system. This is one of the major issue that we need to grapple with. And of course, the issue of pricing. Pricing again is an important issue. Drug pricing is extremely an important issue given the fact that almost 70-80% of households' out-of-pocket spending is spent on drugs. So people like you and me who access drugs from the private chemists, we all know that the prices are almost uncontrolled in this country. So pricing becomes an important issue. In addition, there are other issues, which is question of India, of course, is the problem of irrational use of medicine. Not only irrational manufacture, prescription, dispensing, and use of medicines is a big major problem in this country. A country which produces about 92,000 brands. I think no other country in this world produces so many brands in this country. 92,000 brands. I can challenge you, no other country produces so many number of drugs. And so that's a very important issue. But this is again an issue. In addition, of course, the other major issue is the patent issue. India, which has followed a very people-friendly patent policies from about 1970 to about 2005, we have moved away from process to product patent regime, which has larger implications for access to medicine. Let me just move. Okay, let me first address the first question of why did I call the financing mechanism in the country as unfair? It is unfair because India spends about 4.2% of its GDP on healthcare. Currently, India spends about 4.2% of its GDP on healthcare. Most developing countries spend around 5% of their GDP on healthcare. Now, is it low? Is it high? I would say it's almost similar to most of the developing countries. So, but what is the problem? The real problem is the public-private mix. Is that audible? Yeah. So, what is the issue? Why is it unfair? Why is the financing mechanism is unfair? It is unfair because if you look at the distribution of this 4.2% of GDP, who is spending more? The public sector, the government, which is supposed to be spending a lot, spends hardly about 1/5 of the total of this 4.2% of GDP. And the rest, almost 70% of this 4.2% of GDP comes from households. So households, you and me, spend a lot of money on healthcare. And if you look at this out-of-pocket spending, it's been going up and up phenomenally over the especially last 20 years or so. It's really gone up. We all know why it has gone up. The simple reason being the government has been underspending while the private sector, the growth of the private sector has been tremendously going up. And that is one of the major factors why the household spending is going up and up over the last 20, 30 years or so. But if you look at the composition of this household spending, what is that's being spent in large amount of this household money? If you look at this chart, it's very clear, it's very apparent that a large part of this household spending actually goes on out-of-pocket and outpatient expenditure care. And I'll come back to this in the next slide. While on the other hand, the mix is basically about 2/3, 1/3. Households spend about 1/3 of their household expenditure on healthcare on hospitalization coverage, while the rest, 2/3, is actually spent on outpatient care. So we go to the next slide. Okay. All right. So if you look at the share of the household's out-of-pocket expenditure, we do see that almost, as I said, 1/3, 2/3. 1/3 goes for inpatient expenditure, hospitalization expenditure, and about 2/3 actually is spent by the households on outpatient expenditure. Right? And if you look at the household spending by different categories, if you look at drugs, for instance, drugs itself assumes about 69% of the total household spending. 69, almost 70% of household spending on healthcare goes into buying drugs. This is the major issue. Right. So somebody talked in the morning about people going into debt and so on and so forth due to out-of-pocket spending. It's very apparent. If you look at the National Sample Survey data, we find that almost 13% of India's population actually incurs what is called catastrophic spending. And what is catastrophic spending is, can be defined as if an household spends about 10% of their income, total income on healthcare, then it is considered to be catastrophic expenditure. Okay. So if you assume that if you take 10% as a cutoff, 13% of our Indian population are incurring catastrophic spending. which is very, very high among the even among the developing countries. Okay, so that's the major issue. But having said that, I just wanted to bring to your attention some of the policy intervention that's been on in this country for the last about 4 years or so since 2007. And what has been the two major policy intervention in this country? NRHM, which came in 2005, starting from 2007, we have seen a plethora of health insurance schemes, publicly funded health insurance schemes, whether it is RSBI, which is a national scheme, or Arogeshri scheme in Andhra Pradesh, Tamil Nadu. We have other health insurance, publicly funded health insurance schemes in Tamil Nadu. Again, in Karnataka, Karnataka is again an important, very interesting case where there are 3 health insurance schemes running in Karnataka. Publicly funded health insurance schemes. Now, what do these publicly funded health insurance schemes do? Their major focus is on hospitalization coverage, either secondary or the tertiary care hospitalization coverage. But what is the evidence? It's an evidence from the National Sample Survey. And what does the evidence shows? The evidence is very clear that households actually end up spending a lot of money on outpatient care and not on hospitalization coverage. But our policymakers, instead of focusing on outpatient expenditure, their focus now is on hospitalization coverage. The evidence is there, but our policymakers have taken their own route to address some other issues. Okay, I'll leave that. I can address this question a little later if you have any questions. Can we just move on? Okay. Having said that, so that's about the household spending. What does our government spend? Does our government spend? As I said, Indian government, both central and state government put together, spend about 20% of their income. But if you look at the government spending on drugs, it's very interesting. Just look at the way government spend in this country on drugs. On an average, government spend about 12-13% of the total spending on healthcare. Just about 12-13%. But having said that, I must qualify the fact that except few southern states such as Tamil Nadu, Kerala, and to some extent Karnataka, which spends about 14-15% of their total health expenditure, the rest of the states, and in fact most of the states I would say, they spend anywhere between 4 to 5%. And in fact many states even spend less than 3% of their the government spending which goes into drugs. So many state governments spend a very little amount on drugs, and that is precisely why you see there's hardly any medicines in the public health facilities. So shortages and stockouts are a norm in this country. And why? And this is one of the reasons. We spend hardly any money on buying drugs. Procurement